Welcome back. As the days become shorter, you may notice your mood worsening or difficulty getting out of bed. That could be tied into the lack of sun. This Wellness Wednesday, we're tackling seasonal affective disorder with Dr. Natalie Gentile. And you're the director of Direct Care Physicians of Pittsburgh. And this is such an important topic this time of the year. I just posted a picture the other day as I was driving home from work. I'm like, I'm not happy about it getting darker at all. So what is seasonal affective disorder?
I'm seeing it so often now, and it's like every year it's like a surprise to me.
Right?
When the seasons start to shift, it's this recurrence of depressive symptoms, anxiety symptoms, problems with sleep that really seems to correlate with changes in the amount of sun that we're getting.
So what kind of, who does this affect? Is it kids, adults?
It can affect anybody. I, of course, see it more often in adults. I think adults are able to articulate that better, but certainly sleep schedules are changing, and sun schedules are changing for everybody. So even in kids, we can see problems with their sleep and maybe it affecting their mood, and they just aren't able to say it as easily.
So what kind of symptoms do we see in adults?
Yeah, so I see agitation, irritability, depressive symptoms, upticks in anxiety. I think the sleep issue is the biggest driver, I'd have to say, because when the days are getting shorter, the nights, the darkness is longer, people aren't really getting into their regimen of waking up, let's say at 5:30 or 6 in the morning to, get their day started. They're sleeping a little bit later, it's a little bit darker. And then their evening wind down starts to happen a lot earlier. They're not as productive, they're not out and about as much as they used to be when it was in the summer and spring, and this really affects a person's mood.
You know what's crazy too? I think about this and I see my daughter's mood changing. I have a 5.5-year-old. What can parents do to maybe help their kids they don't know what it is, we know what it is. What can we do to help them?
One of the biggest things I think to help kids and adults is routine. We are creatures of habit as human beings, so what can you do that's consistent? Consistent wake-up times, consistent bedtime regimen, consistency with how you're eating, how you're moving throughout the week as much as possible, I think really helps people feel a little bit more control when they otherwise feel out of control.
Wow, yeah, that's really good. And there's light therapy that you can do. What is that? I always hear about it because there's different types of lights. There's like red light and blue light, but which one?
Yeah, so these light boxes are non-UV or very little UV emitting. They're LED lights, and you want to use it within about the first hour of waking up in the morning. You can also just have it, say you're sitting reading a book. The manufacturer will tell you how far apart it should be from you, but just kind of nearby you or even when you're watching TV. And it's nice to just have that light. It helps your body start to get into a different regimen and routine with the way that it's communicating on how you handle emotions, and your fear response is how some of the studies have shown it helps.
So how does vitamin D then fit into all of this?
Yeah, so when I have patients that are presenting maybe for the first time during this time of year saying that they've got depressive symptoms all of a sudden, one of the first things I do check is vitamin D, because I have seen so much vitamin D deficiency in this region especially, and it's something we can help. Right? There's vitamin D supplementation, or there are foods like fortified milks or mushrooms, oranges, some of these plant foods that can be helpful to raise that vitamin D, and we can help. So talking with your doctor about checking a vitamin D level, I think, is kind of a low-hanging fruit.
Yeah, so when we talk about seasonal affective disorder, that's more mental, but vitamin D deficiency, that's more of a physical thing. So what symptoms do you have to look for with that?
Yeah, so similar. So we're looking at depression and anxiety. We're looking at problems with sleeping. These are really common things that we see with vitamin D deficiency that overlap with more of a mental health condition, but also could be causing those symptoms. So important to look into.
I know, this is all interesting because it really affects day to day, and then the days get shorter. So what do you do to treat it?
Yeah, so I definitely, if there's an underlying cause, look at that. If there are thyroid concerns, vitamin deficiencies, certainly taking a look there. But then we can talk about the light box, we can talk about talk therapy or psychotherapy. Social support is huge, especially during these dark months. Okay, so getting out and having community and routine, very important. And then if there are medications out there, I definitely have patients who have to be on some kind of medication regimen, even just during these winter deep, dark months, because their seasonal affective disorder is really debilitating.
Yeah, and mental health is such a hard thing to talk about, and it's so hard to even ask for help. So I think if you have that community that you can really kind of get together and just talk about it and get the conversation started, it really helps.
Yes, break the stigma, normalize it.
I love it. Thank you so much for joining me today.
Thank you.
And if you're interested in Direct Care Physicians of Pittsburgh or Rebel Wellness, you can head to our website at kdka.com/talkpittsburgh.